One of the most misunderstood things in pain science is the difference between pain threshold and pain tolerance. Clients and even therapists use these terms interchangeably all the time, but they are actually very different things. And understanding the difference here can completely change how you think about pain, deeper pressure massage, and even the constitution of toughness. Your pain threshold is the point where sensation first becomes uncomfortable or painful. Basically, it's when your nervous system goes, okay, this is painful now. So for example, if I press on your upper trapezius muscle at a certain point and you go, oh, there it is, that's the threshold. It is the minimum intensity needed for your brain to label something as painful. And here's the important part. Pain threshold is heavily influenced by your nervous system, stress, fatigue, inflammation, anxiety, past experiences, sleep, and even hormones. This is why the same pressure can feel totally fine one day, but absolutely intolerably awful the next. Pain tolerance is different. Pain tolerance is how much pain are you willing or able to endure. Not when the pain starts, but how long or how intense you can handle it after it starts. This is why someone can have a low pain threshold but a high pain tolerance, or vice versa. So for example, someone could feel pain very quickly, but calmly be able to sit through a tattoo for 6 hours. Another person might not notice pain easily, but once they do, they are immediately done. Different nervous systems come with different coping strategies. This matters a whole lot in massage therapy, because many therapists accidentally assume the client tolerated deep pressure, so the client benefited from that deep pressure, but not necessarily. Some clients have extremely high pain tolerance. In particular, athletes, chronic pain patients, trauma survivors, and people who are socialized to ignore discomfort. They may endure way more pressure than what is actually helpful. And just because someone can tolerate intense pain doesn't mean that the nervous system experiences it as therapeutic. This is where we get the cultural obsession with no pain, no gain. And look, some discomfort during massage can absolutely feel relieving or productive, but more pain does not automatically equate to better treatment or a more significant release. The nervous system is way more complicated than that. In fact, extensive pain can sometimes increase muscle guarding, stress responses, and sensitization. Modern pain science shows that pain is not simply amount of damage equates to the amount of pain. Pain is a protective output from the brain and nervous system, meaning context always matters. Your pain experience can change based on fear, expectation, environment, trust, emotion, and previous experience, which is why therapeutic relationships matter so much in massage therapy. So if your massage therapist asks, how does the pressure feel? Don't answer based on, what do I think I can survive? You should answer based on what actually feels helpful and sustainable. You don't get bonus healing points from anyone for suffering through a massage.